Prepare the materials needed, your medication administration record, and your vial. This is your vial. Then appropriate syringe for injection, and viscosity of the solution, extra needle, alcohol swab, and lastly your medication tray. So perform hand hygiene, organize the equipment, check the label of the medication of the vial, and with the order of drug medication.
Using 5 rides of
And
drug medication,
you perform dosage calculation. The vial contains more medication than client requires. Remove the tin sealed cap without touching the rubber stopper. Then you wipe the medication with alcohol swab. Read the label of the medication as well as to the amount of dilute you are going to use. So you're going to dilute or reconstitute the powdered drug in the vial. Dilute or reconstitute the powdered one in the vial. Put the amount needed for injection, then remove cap if necessary. So do not touch the inside of the plunger.
using a slanted angle, firmly insert needle into the center of the rubber top of the vial. With the sharpest point of the needle, the tip of the needle entering first. Continue insertion until needle is secured in the vial yet above the level of the fluid. Press the end of the plunger down to instill air to the vial. Hold the vial with the non-dominant hand and turn it down. Keeping the needle inserted, control syringe with dominant hand and keep plunger down with thumb. Pull needle back to point which needle is beneath fluid level. Keep needle as long as the fluid is withdrawn. Slowly pull the end of the plunger back until appropriate amount of solution is aspirated into the syringe. Air bubbles when they appear. Gently flick the syringe with fingers of the dominant hand. Keep a finger on end of the plunger and continue holding vial with non-dominant hand. When no additional solution is needed, pull the needle out of the bottle while keeping the finger on end of the plunger. Apply needle to syringe if IM or sub-Q or intradermal injections will be needed.
Move the plunger down while holding. Then slowly remove the needle. Then do scooping technique. Shake well the vial. Check if it is diluted well. After putting the medication in the vial, it's time for you to withdraw the medication.
In withdrawing the medication, you just open the cover of your needle syringe. Then withdraw the plunger down the exact amount that you are going to get from the medication vial. If it is 1.5 ml, so measure 1.5 ml. Then you insert, inject between the rubber, then move the plunger down to instill the air, then invert it like this. Get the exact amount of medication. The exact amount of medication you are going to withdraw is the result of your drug calculations. Then do scoping technique. Then you are now ready to give the medication to your patient.